Hey guys, how you doing? If you were watching this video, you probably searched low testosterone. Right off the bat, I'm going to let you know this is my journey through testosterone replacement, okay? And I'm going to try to make this first video as quickly as possible, but there's a lot of information I got to tell you about because when I searched this topic, I didn't find a lot of information that was helpful for me. I found a few testimonials, but I really didn't find the type of information that I needed. So hopefully I can give you what you need. If you have any questions, make sure you ask in the comment section below and I'll try to answer them in my next video update. Now, so that I get through all of the things that I need to talk about, I've got an outline because I have an awful memory. Boom, cardboard. Perfect. All right. So again, I'm TJ Jaglinski from Douglasville, Georgia. I am 42 years of age, and actually yesterday was my birthday. I weigh approximately 210 pounds. Now, how did I find out that I had low T? I had a hunch that I had low T. It's weird. I've always thought that I had low testosterone. Here are some of the symptoms that I was dealing with, and it's pretty much all the symptoms that I found that low testosterone will give you. Low sex drive. My sex drive had significantly decreased. It wasn't awful, but my wife wasn't exactly happy. So that was one of my warning signs. Erectile dysfunction. Now, I was okay, but it wasn't like it used to be. And I really wanted it to be like it used to be. Fatigue. I am always tired. And I always have been tired. It is so hard for me to wake up in the morning. During the day, I'm yawning. I'm just, I don't have the energy to do anything. Muscle mass decrease. Now, I haven't seen necessarily a muscle mass decrease because I believe, I can't prove it, but I believe that my testosterone has always been low, so I never really gained the muscle to lose. I work out a lot. I've always been athletic, always involved in sports, and was never able to gain the muscle mass that everybody else did. Body fat. You gain body fat when your testosterone decreases. Now, I've always had a very fast metabolism, so I didn't really have to deal with body fat that much until recently. Recently, it's gotten worse. Depression. I already said I'm on anti-anxiety medication. I have dealt with depression and anxiety. But because I'm on the medication, I think that, I don't have that symptom anymore. And I finally decided that now was the time to get tested. Went to my primary care physician. He did a blood test. Sure enough, I had low T. Well, he told me that you don't see those low T commercials on TV anymore, do you? The little gels and stuff that they sell or sold. Because there was some research done that said that they can actually hurt your heart, which is not a good thing. However, I found out after that that if you don't already have a heart condition, testosterone replacement has shown to not trigger a heart problem. So if you already have a heart problem, it's not good. If you don't have a heart problem, you're good to go. So my primary referred me to a urologist. Went to the urologist. He looked at the blood work and said, yes, sir, you have low T. However, they did not do an exhaustive blood test on the specific things that he needed to see. So, of course, had to go have another blood test. Well, when I came back for the results of the blood test, I had a certain level of my blood that was elevated. It was prolactin. Now, I'm not going to go into what prolactin is. You can look it up. But I am on some antidepressants and different things, and anxiety medication, and that can actually raise the prolactin, and that's what I think the problem was. However, prolactin elevation can also be a sign of a pituitary tumor. So he referred me to get an MRI on my brain. Good times, MRIs. Well, came back for my results yesterday actually, back to the urologist, and we're all clear. So no pituitary tumor, and he said we're good to go with testosterone replacement. Had my first injection yesterday. and boy does my left butt cheek hurt. Yeah, it feels like somebody smacked me in the butt with a bat. So I have to go back every 2 weeks and get another injection. They'll swap cheeks back and forth. I already told you that I'm going to go back every 2 weeks. And what I want to do is document my journey. And for anybody out there who is thinking about having their levels checked, maybe they think, you know, should I do this? Should I not? This will maybe help you decide. If you have any questions, again, comment in the comments. Ask a question. I'll try to answer it whenever I make a new video. And the last thing I want to do is comment on some videos that I saw. One in particular was an older gentleman, probably in his 60s, 50s, something like that. He was on a news program, and you've probably seen it, where he talked about what a miracle drug testosterone was for him. And that it was almost like going to the fountain of youth. And so I'm interested to see if I had the same effects. Right now, I don't feel any different. I've had testosterone in my body for 24 hours now. And so again, this is going to be a documentation of the effects on me. And in order to get the baseline, so you see the baseline of my results, I guess I need to shed the shirt to show you the muscle mass, or lack thereof. This is a body that has worked out for about 9 or 10 weeks now, pretty regularly. I took 1 week off for vacation, but other than that, 3-4 times a week I've been working out. And I wasn't much smaller than this when I started, so I haven't gained a whole lot of muscle mass or strength in the gym. So hopefully testosterone will help me out. It'll help me lose some of this love handle. And in case you're wondering, the scar from reconstructive surgery on my chest, or a modified rabbit procedure because I had pectus excavatum. Look it up. My chest looks a lot better now. So we will see you in about 2 weeks right after my next injection.